Are you struggling with chronic conditions like chronic fatigue syndrome, fibromyalgia, or IBS? Or do you have a history of things like kidney stones, osteopenia, osteoporosis, depression, or anxiety? Have you tried eliminating these things or managing them and wondered why your body or your mind don't feel like they're responding? Maybe you've done things like change your diet, you've tried probiotics, you've done detoxes, counseling, or gut health protocols, but your energy's still low, your mood's still off, and you still feel stuck inside. What if I told you your body might be trapped in something called a calcium shell? A calcium shell is one of the most powerful patterns I see on HTMA testing, and it can explain everything from chronic fatigue syndrome, fibromyalgia, brain fog, depression, and anxiety to constipation, bloating, IBS, kidney stones, and even osteoporosis or osteopenia. If you've ever felt like you've been doing all the right things, but your body just isn't budging, this episode is going to open your eyes. In this episode, you're going to learn what a calcium shell is, common causes of calcium shells, why so many people with hidden copper toxicity and thyroid issues have calcium shells without knowing. I'll also cover what you need to do to reverse calcium shells, maybe the most important thing, and why breaking through a calcium shell can completely change how your body responds to food, supplements, and stress. So if you've ever felt like something is missing on your healing journey, this might be it. Let's dive in. Hey friend, welcome to the Better Belly podcast. If you're currently trying endless supplements, doctor visits, and diet changes to heal your mystery symptoms, you are in the right place. We're here to solve the real root causes behind your gut, hormones, skin, sleep, and brain concerns. Literally anything and everything in your body. My name is Allison Jordan. I'm a functional medicine practitioner that has supported over 150 clients just like you to heal problems that no one has been able to fix. You don't need a perfect diet or a random supplement you found on Instagram to heal. You need a proven system that heals your whole body from the inside out. That's what I'm here to share with you, episode by episode. It's time to make health easy again. And just as a reminder, this information is not meant to diagnose, manage, or treat disease. Always consult with your own health practitioner before you make any changes to your health. All right, guys. So this is probably one of our most requested podcast episodes by clients. I currently have clients in our Better Belly Blueprint program, clients getting group coaching, clients getting VIP, working with us one-to-one, because it's something we teach our client deal with. We don't necessarily have a huge resource on everything behind it in our program. And so this is actually giving the opposite. Where in our program, we're teaching them, like, here's how to evaluate your lab. This is what it looks like. You do or don't have it. This is what you're going to do to get rid of it. And people just wanted a deeper resource. And so I thought, why not on the podcast where everybody can listen to it? So let's just start off. We're going to go A to Z calcium shell. Maybe you've never heard this term before and you're like, whoa, what are you talking about, Allison? Where is this coming from? What type of labs do we need? We're going to cover all of this, where it shows up, what type of lab testing shows it, or maybe you have heard of it and you know you have it, or you think you have it. And we're going to cover everything, how we reverse it, all of it. So let's start off. What is a calcium shell? So a calcium shell is not a diagnosis. It is a description of when calcium builds up in your soft tissues of your body instead of your bones in your teeth. And this can either be a buildup that happens from simply calcium leaving your bones and teeth, which is one disease process, which is also reversible, y'all. But it can also happen due to malabsorption of calcium or excessive calcium supplementation. But what happens, the most important component, if you learn nothing else, in my mind, what I would hope you would walk away with is understanding that calcium is in the wrong place in your body. And calcium, it's a mineral. It's hard. When it piles up, right? If you think of, like, if you have hard tap water and you get calcium deposits, and there's other minerals, but there's calcium deposits around your faucet, it becomes a hard, chiselly thing. So imagine a hard mineral building up in your soft tissue, like your eyes, your muscles, your skin, your joints, your fascia, your brain, your nerves and nerve endings. They are considered soft tissue. They're not bones. When that happens, it creates a lot of pain and a lot of dysfunction. And I commonly see high calcium on a HTMA, which is the testing we get. I'll talk a little bit more about that if you're not familiar with it. But what I commonly see, the symptoms that I commonly see associated like very quickly with high calcium on HTMA, it's going to be things like chronic pain, stiffness, joint pain. Why? Because calcium is literally calcifying. It's mineralizing. It's getting hard. It's turning into rock in soft places where it shouldn't have that. So one of the most eye-opening cases, which I'm going to actually dive into a little bit towards the end of the podcast episode, on a calcium shell, was my first ever fibromyalgia client who worked with me. I had actually been working with her as a massage therapist at the time, and when I got my training as a functional diagnostic nutrition practitioner and learned how to evaluate and order labs, I said, hey, can we just look at a couple labs for you? And literally her fibromyalgia pain, which she'd had for 10 years, literally went away the next time, within a 6-month period. And the next time we did another retest to see if the calcium shell was there, it was totally gone. So this then brings us to the next most important question, like what are the symptoms of a calcium shell? Like what are the other things that you might have? So I just want you to think about all the different soft tissue that we listed. Those are the soft tissues. Those soft tissues being calcified is where you're going to get these symptoms. So think, we already covered chronic pain, stiffness, joint pain, muscle cramping, spasms, twitches. Do also think, when we're talking about muscles, think gut movement, gut cramping, because our gut is made of muscles. That's how we're moving food along the digestive tract, is muscles. So think IBS, think chronic abdominal pain. That can be a component of it. There's a lot of things that can cause gut pain or abdominal cramping, but one of them can be a calcium shell. Bone spurs and impaired circulation, think Raynaud's. Slow oxidation symptoms. And slow oxidation, it's a unique term for HTMA users, if this is a very specific type of test, but it has to do with fatigue, sluggishness, slow healing, brain fog. It's just everything in your body is slowing down. That's what a slow oxidation state is. A lot of copper toxicity symptoms, because copper toxicity can be a driver to calcium shell. If you're not familiar with copper toxicity, I do a deep dive in episode 159, which I'll link in the show notes for y'all. Copper toxicity is fascinating. It's also found on the HTMA, so it's kind of like a win-win. You can see both of them in one test. But copper toxicity symptoms, if you have a copper toxicity driving calcium shell, you might not just have this like sluggishness of the calcium shell, but you also, or more importantly, might have like anger, snappy, irritable, racing thoughts, anxiety. That's more of the copper toxicity talking. And then on top of it, you might have achy joints, achy muscles. Additionally, you might have some calcium shell symptoms if there is a calcium shell. You can have a hypothyroid symptom presentation simply because a calcium shell or hypercalcemia, which they are different, by the way. Hypercalcemia is a diagnosis. It's usually determined by blood work where calcium is too high in the blood. But calcium shell is like a non-blood work version of that. And so you can see hypothyroid symptoms in this, which is fatigue, weakness, bone pain, cold intolerance, frequent urination, constipation, and abdominal pain. Mainly because think of the IBS symptoms of like sluggish motility, bloating, constipation. So again, IBS can be kind of a diagnosis you get when calcium shell might be a component of what's driving it. So we actually just covered some diagnoses, but a calcium shell might look like an IBS diagnosis, fibromyalgia, chronic fatigue syndrome, kidney stones. Kidney stones can also be possible with something called oxalates. If you've never heard of those, I highly recommend go check out episode 148, the oxalate episode of this podcast. And I have that linked in the show notes. We also have osteopenia, osteoporosis, and arthritis. Those can all be diagnoses. And especially with that osteopenia, I have seen osteopenia reversed in my clinic. When clients go through our process, we find a calcium shell, We help them revert it. And then the next time they get a bone density scan, that area that the doctor was concerned about will revert. And they'll be like, oh, whatever you're doing differently. They think it's the calcium supplement they're taking, or like, good job for taking your calcium supplement. Even though the calcium supplement hadn't worked the last 5 years, it suddenly started working. Yes, there is a reason for that. And it has to do with how your body's processing calcium. But poor dental health and tooth decay, because the calcium is not staying in your teeth, staying in your bones. We can have sensitivity to EMFs because of how calcium as a mineral responds to other electromagnetic frequencies. So that can cause insomnia at night, mood instability, a lot of neurological symptoms, and then even more neurological symptoms, not related to EMFs, but more related to the nerves getting calcified. So a lot of apathy, depression, feeling disconnected or checked out, flat mood, emotional numbness or withdrawal. Think like maybe lack of desire to socialize, or really struggling with visualizing or having goals, and then brain fog, which of course is a very common symptom of chronic illness. So those are a lot of symptoms you can have, and you can have all the symptoms and not have a calcium shell, which is why I 10 out of 10 recommend that you get personalized testing. Get personalized testing, because otherwise you're just throwing spaghetti at the wall, and you could actually be driving in, like if you don't have a calcium shell and then you do calcium shell techniques to help it, you could actually then deplete your body of calcium, just actually deplete it. And then instead of bringing it into balance, if opposed to like a calcium shell is too high of calcium, you pull it back to normal. If you're at normal or even low and you do calcium shell techniques, you could put yourself even into lower levels of calcium and still have a lot of those symptoms. So don't 100% take it off of symptoms, but some of these that stand out that are like much more like calcium shell-esque, I'd say fibromyalgia, any type of chronic pain, osteopenia, kidney stones or a history of kidney stones. Those are some ones that are like very, to me, I'm like, ooh, I'm really curious if that person has a calcium shell. So how do you test for it? A calcium shell is not something you see in blood work that you get from your doctor. So blood calcium is really closely regulated by your body. Your body wants to be within a normal range. And actually, I have seen people with calcium shells on an HTMA, which is how you test it, with blood work that has either high or low calcium, and we'll get into that. But the only way to see a calcium shell, the way that we're talking about it, is through a hair tissue mineral analysis test, or for short, we call it HTMA. So it's basically you're taking hair that you're cutting, you're taking some of the hair that's close to the scalp, send it into a lab, they evaluate that hair, and they're looking at the last 3 months of output of minerals from your hair. And there is a regular rate that your hair should be depositing minerals into your hair. But when they test it, if there's a normal amount that zinc would be coming out in the hair, or mercury, or calcium, or magnesium, or sodium, it can be high or it can be low, where you're not getting as much of that. So, the only way to see a calcium shell, the way we're talking about it, is through this test. The nice thing about this test, it does test more than just calcium. It can test potential toxins that are driving that calcium shell, and also other disease states that you might be dealing with. But on a hair tissue mineral analysis, it's going to show up when the calcium levels are over 170. That is the technical or the typical like calcium shell number you're going to find in textbooks of the doctors who developed the HTMA test. I personally find a calcium shell is relevant over 100. I do see clients with calcium shell symptoms, and I will do some moderate treatment of that and addressing it in our protocols if it's over 100. But the typical number is 170. And then what else? I'm just looking at my notes here, making sure I said everything. Yeah, that's how you test it. Is it over 100 is how I look for it. If you're being a little bit more like by the textbook, is it over 170? And here's the blood work connection. If you don't have an HTMA, or even if you do, something to keep in mind is that your blood work can look high or low in the calcium. It could even look normal. What I have personally found, though, is that The most common pattern, if someone has a calcium shell on their HTMA, the most common thing I see in their blood work is that their calcium is low in their blood work. Why is this? So there's several reasons why that it makes sense scientifically. And when I say this, it's just because I can't say like research has proven. But when we're thinking about the mechanisms of the body, you want to be thinking if calcium's high in the soft tissue, it's usually because of what I covered at the beginning, a absorption issue of calcium that is being introduced to the body via diet. There's something going on that new calcium is not being properly managed, or it's an excretion issue of that actually calcium's getting pulled out of the bones and teeth and then not being managed well. So why would these factors happen? So calcium, number one, is low stomach acid. Calcium must have a high acid environment to be broken out of the food matrix and be used in a bioavailable form. So if you have low stomach acid and you then intake calcium, whether it's from a supplement or just dietary intake, meaning food, your body might not be actually breaking down the calcium and interacting with it well enough to make it bioavailable. And then it can bind with things like oxalates. It can get malabsorbed and then end up in your soft tissue. So low stomach acid, if you're like, how do I know if I have it? I do have a free resource. Go to betterbellytherapies.com/constipation. It's actually says something about like 3 natural remedies to constipation. But in that PDF, I have a recipe for something called the baking soda test. And it is a very simple test you do first thing in the morning with some baking soda and water to see how fast you burp. And this burping response is like a general measure of your stomach acid in the morning on an empty stomach. That can give you an idea, just an idea of if you are dealing with low stomach acid. So if you want to go and get that recipe, go over to that PDF. But low stomach acid is the number one cause of acid reflux. It's actually getting talked about more now than when I started the podcast back in 2020. So maybe you already know that. But if you want to learn a lot more, like if you have acid reflux and some of these symptoms of a calcium shell, or like you have an HTMA and you're like, oh my gosh, I have a calcium shell, then like there could be a very strong connection. So finding the root cause of your acid reflux, which might include component of that could be low stomach acid, or if you've been on a PPI to manage acid reflux and that has induced low stomach acid, that could be one reason why you have a calcium shell. It's kind of like a down the road effect of other root causes. If you want to learn more about acid reflux, I'm not going to get all into it, but I do have some great resources. Go to episode 40 called Reduce Acid Reflux with the Magic Power of Zinc. I really get into low stomach acid in that episode. And then episode 285, 2 steps to reversing your acid reflux for good. That episode doesn't just look at low stomach acid, it looks at all the components that I have seen to reverse acid reflux. So I do recommend that episode if you want like if that's a hot topic in your life, go to episode 285. All right. So that's one thing. Low stomach acid can really impair calcium absorption. Number 2, high oxalates. Now, maybe we've never heard of oxalates before. It is something we get exposed to in food. It's also can be a byproduct of a candida overgrowth. If you have a candida overgrowth in your gut, typically oxalates aren't going to be an issue for most people in their diet or due to candida because of our gut barrier but if you have leaky gut, which is, I have an episode, I wasn't planning on sharing that, but I have an episode on leaky gut and why leaky gut tests are not helpful, but like what leaky gut is actually telling you. Let me go pull it up since I didn't have it ready for this, but leaky gut's the only reason that you're really going to have issues with oxalates or a candida overgrowth, and they usually do come together. It's episode 273. Stop doing leaky gut tests. Do this instead. I'll just put this in our show notes so I don't forget. All right. So that's oxalates. Oxalates can bind with calcium and then become even worse. And oxalates are sharp little crystals that are kind of fine on their own, but if they clump together, and especially if they clump with calcium, they become really, really hard, sharp rocks. And that can be something that you find in your kidney stone. So that's one reason if you get a kidney stone, your doctors want you to try and catch it when you excrete it. So if they are able to get it into the bladder, they then want you to filter your pee out so that you can catch the stone, because they then want to go and look at what is that calcium, or what is the kidney stone made of? Is it made of calcium? Is it made of oxalates? Is it made of both? So that's a big thing. And then calcium, the next reason why calcium can be low on a blood work but high on an HTMA is that the calcium basically is in your tissue. It's not in the blood. So you functionally have low calcium on a usable level, but it is still high in your tissue. And the cool thing is that your hair can show it. So you just want to understand the different way these tests think, essentially, or that they see. It's not that one's right and one's wrong. It's that they are looking at different things. So, but as a reminder, I've had clients with calcium shells who have normal levels on their blood work and high calcium on their blood work. So the summary is you just need a HTMA to really see a calcium shell. All right, what causes a calcium shell? You're like, why do I have this and not somebody else? We already kind of covered some of this, so I'll try to quickly go through them. Number 1, low stomach acid because of malabsorption of calcium. Number 2, gut pathogens. Basically, when you have gut pathogens could be one of the issues. Sorry, my notes confuse me here. Let me just back up. For gut pathogens, they can cause issues on 2 levels. Number 1, they can cause your body to have leaky gut. And then your leaky gut means that your gut lining barrier, it has a bunch of holes in it that are bigger than normal. And so you start to absorb calcium in a undigested, biounavailable way. So that could be one issue. But another thing is that your gut pathogens, if you have gut pathogens, especially I like to call them hidden, meaning your doctor hasn't found them. I know it happens a lot, unfortunately, but those gut pathogens can then cause calcium to leak from your bones and teeth. You're like, what? How is that possible? So the main thing is actually pain. We have actually seen that if somebody has a lot of psychological pain, like trauma, stress, anxiety, that is chronic, or physical pain. So that could be a lot of my clients with abdominal pain that they've had for 10 years, or muscle pain that they've had for a long time. Pain elevates our nervous system, and calcium can actually be a way that we basically numb our nerves to help us cope with pain. And so it is a really interesting process. The majority of my clients with calcium shell, I see a strong correlation with just getting a calcium shell from having a lot of pain, discomfort, and dysfunction caused by all their gut pathogens that they're dealing with. And just the general stress of being sick, not being able to go to work, feeling really crappy when you're at social events, feeling stressed about eating food. Those are all forms of stress that are known to cause a calcium, like your body to try and calcify your nerves to manage the stress. So additionally, on top of this, some pathogens like H. pylori can drive other root causes. So H. pylori is a gut pathogen in the stomach. It can drive low stomach acid. That can be an issue. Or C. diff can drive a lot of anxiety because of how it creates an enzyme that blocks the conversion of dopamine to norepinephrine. It blocks DBH, dopamine beta hydroxynate, something like that. I think it's hydroxylase. Don't quote me on it, but it's DBH. I have a podcast episode on C. diff if you're interested. It's episode 273. C. diff infection symptoms, how C. diff is spread, why chronic C. diff is missed. And I have an H. pylori episode. If you're like, well, I've already treated H. pylori before, or my doctor said I had it and I took antibiotics, but I still feel ick. Very common stories. Go listen to episode 233 on H. pylori. All right, that's another one is gut pathogens. So food sensitivities can cause a calcium shell. How? Mainly indirectly, they can damage the gut lining because of causing inflammation when you're eating a food you're sensitive to. Then that impairs proper absorption. You have a lot of high inflammation levels as well, and that decreases absorption of many nutrients, including calcium. Mineral imbalances and toxicity can drive a calcium shell. So copper toxicity. Episode 159 covers what copper toxicity is. Iodine deficiencies can drive a copper toxicity shell because iodine breaks down excess calcium. And if you're deficient in iodine, you're not going to break down that calcium super well. I have episode 274, is iodine deficiency causing your constipation or hypothyroidism? If you want to go listen to that episode. I also do have a resource on my like personal iodine deficiency self-assessment and protocol. If you want to go grab that, you go to betterbellytherapies.com/iodine or look at the links in the show notes. And then you get a mineral imbalances and toxins. Like if there's excess calcium in your drinking water that you're drinking, it's not filtered, or if you're taking a lot of calcium supplements, tends to happen. Just like women, as we get older, they're like, oh, you're older, you should take calcium, which is great if you can absorb calcium, but they're not even evaluating if you, as an aging woman who they want to have you avoid osteopenia or osteoporosis, they're not even evaluating if your body can properly absorb it, which is why you have these women who get put on calcium supplements and then they still get osteopenia and osteoporosis. And the doctor's like, well, we tried. And they'll even sometimes double they'll say, okay, let's just put you on twice as much calcium. And it's all going into your skin and your muscles and your joints. And these women come and they're in their 50s and 60s and everything hurts. Their joints hurt, their muscles hurt, everything is stiff. They're trying to exercise, but it hurts. They don't recover very fast from working out. And then their doctors are upset that they have osteopenia and that, and then they just up their calcium. It is a horrible vicious cycle. And then another thing that can disrupt mineral imbalances or mineral balance is high EMF exposure because it disrupts calcium channels. Calcium is one of the ways that our nerves actually fire. So you can overcalcify a nerve and then it doesn't function properly, but calcium channels is part of how nerves fire. And so I personally have not seen EMF be a high correlation with any of my clients yet, but I am aware that if you live close to a cell phone tower, it's a 5-mile radius is what the research shows, or close to power lines. I don't think they have a mile radius on that, but like if you have like a huge power line right in your backyard, that is definitely close enough. So cell phone tower or kind of like the mega power lines, those have been found to be very disruptive to people's health over the long term. So it's not going to be like, it's not going to seem super obvious, but it's going to be over years of that exposure. So, and for some clients, it can be more obvious if, again, these are only not the clients that I've worked with, but there are stories I've heard of people who have done things like sought out an EMF-free room just to go in, and they get in the room and it's the first time they've had symptom relief in like a decade. Those are EMF sensitive clients. But they have to work really hard to downgrade their EMF exposure because it's so ubiquitous in our world. Number 5, endocrine and thyroid dysfunction can drive a calcium shell. This is the least common cause that I see, but it can be an effect. So if you have a calcium shell, you'll get a lot of symptoms of hypothyroidism. But low iodine levels can also drive hypothyroidism, and then by virtue of that, drive a calcium shell. And then hormone imbalances can slow down calcium metabolism. So if you have hypothyroidism, slows down calcium metabolism, can result in biounavailable calcium in your soft tissue. And then lastly, we've already talked about this briefly, but emotional and nervous system stress. So chronic emotional trauma or long-term stress from being sick, from financial stressors, relational stressors, trauma, childhood. Basically your body's saying, I'm not ready to deal with this. This is too much. The body armors up, it shells up. It can do that on a actual biochemical level with the calcium and just get you to a place of kind of flat affect, disconnection, so that your body can get through the state and live through it, but you now are numbed. So when you see a calcium shell, it's not just a mineral problem of like, I just need to take a supplement and like bring my calcium back in. You don't have a calcium shell because you need to take a supplement. Usually there's a lot of other factors going on, but how we can treat it in the short term is what we do in our program, at least, is we do use supplements to help quickly, whatever, calcium the body's willing to put back into your bones and teeth. It will do that when you give it the right supplementation, but that's a short-term solution, something quick you can do. The long-term solution, so that you don't need to keep taking those supplements so that this calcium shell actually goes away, is some long-term, like finding the root cause that is uniquely driving up your calcium shell. Because if you think about all the causes I just shared, the low stomach acid, gut pathogens, food sensitivities, mineral imbalances, emotional and nervous system stress, those things, you could have 10 people with a calcium shell and all 10 of them have a different combination of issues of those things listed that is driving their unique calcium shell. So it's one thing on a test, but the drivers are all different. So now what you want to be thinking about is doing additional testing or looking at the testing you currently have for those drivers. But I do recommend all of these tests. So I'm going to list several, but before I list them, I want you to imagine why. If you were looking at a beach ball and you were looking at one side of a beach ball, you know how beach balls are usually like a color white, a different color white, another color white. It'd be like red, white, blue, white, green, white, yellow, white around it, right? If you're only looking at one side of it, maybe you can see 2 or 3 colors. So it's the red, white, blue. But if you look at another angle, it's going to look like blue, white, green. Or you look at another angle, it's going to look like white, yellow, white. If you only look at one angle and you're trying to get the big picture, you say, well, this is a yellow, white, yellow ball. You're not going to see, and then you treat all the yellow problems and all the white problems. You get done treating those problems and you're like, well, why do I still have my symptoms? Because you didn't treat the red strip and the blue strip and the yellow strip. You want to look at the whole thing. And that's what lab testing that looks at all these issues. You want to look at, you don't want to just say, I'm going to go do a food sensitivity test because Allison said food sensitivities can drive this. Well, if you don't also do the appropriate gut pathogen testing, you could have gut pathogens that are still present that are going to continue driving that if you don't find them and get rid of them. So you do really want to do all the testing. So what I test for and look for, we look for copper toxicity on an HTMA. We look for mineral depletion and imbalances in other minerals on the HTMA. Magnesium, sodium, potassium are big ones. We look for other heavy metals, mercury, arsenic, uranium, also on the HTMA. We look for gut pathogens through the GI map and organic acids test. These can cause low stomach acid, chronic absorption issues, chronic pain, chronic inflammation. Mold is a big driver. It messes with our ability to absorb fat and our ability to digest and creates massive inflammation. Mold's a huge issue found on the organic acids test. Low stomach acid, do that baking soda test. You can also look at your alkaline phosphatase if you have it on blood work. And if it's lower than 70, which is the functional range, like lowest part you want to have for alkaline phosphatase, if it's lower than 70, huge sign of a zinc depletion, and zinc is required to make stomach acid. So it's like a indirect measure of likely low stomach acid. And then test for food sensitivities. I use the Food Zoomer bundle by Vibrant Wellness, and if you've never heard of it or you don't know why, or you're looking at the test and it seems, too expensive or something, go to episode 267, the best food sensitivity test for you. And I go in depth with a ambassador for Vibrant Wellness on what their test is doing different. That literally, I don't know of another test that does this type of testing. If I did, I would tell you guys. But it does testing in a way that other kind of more common name brand tests like Tiny Health or Viome or MRT, that they are not doing, and they are missing the mark, and they are leaving people confused and honestly just missing foods that they are actually sensitive to, and then actually hyper focusing on foods that are not that important. That episode explains it all. So when you do those 4 tests, that's what gives you the information you need to know what is driving your calcium shell and really effectively deal with it. So yes, take some supplements. And those supplements can really vary too. How do you pull the calcium back into your bones? It really varies based off of all of your lab results. So again, those are things we're not going to share on here because I don't want someone to go and supplement them and it's not what they uniquely need. So all of this testing and all of this like big mindset is exactly what we do when clients work with us. And we help our clients get rid of symptoms that they've had for years, if not decades, even when nothing else has worked because of this. And so I told you guys at the beginning of the episode that there was a client who came to me with fibromyalgia. She actually came onto the podcast. Her name is Sharon. She came onto the podcast twice, but her first episode she was on was episode 76, Heal Your Fibromyalgia. with my client Sharon. That's the title. I'm putting it in the show notes. You can go listen to it, but if you don't have time, I'm just going to read a little excerpt from that episode. She was diagnosed with fibromyalgia in her 40s. Since then, she's tried everything she knew to try to help her chronic fatigue, pain, stiffness, and brain fog. She tried diet, food restrictions, doctors, medication, supplements, hydrotherapy, massage, which is how she met me, you name it. Now, just 3 months into following our process, which is when that episode was being recorded, was just 3 months into it, Sharon has no pain. She's able to exercise 5 days a week, and she has achieved her main goal in our work, which is to be able to attend her granddaughter's weekend soccer games, which was super sweet to get to hear her share that with me, because I don't think I knew it when we recorded the episode until she told me. So healing a calcium shell does take time, but it's definitely not like a year's process. It is very possible. And when your body finally feels safe enough and is healed enough to drop that shell, that's when you start to see real long-lasting results. So if you've been feeling stuck physically or emotionally and nothing you've tried is moving the needle, this might be the missing piece. And we would love to work with you. I would love to work with you to help you find if you have a calcium shell, and more importantly, what's driving it and what's driving your other symptoms. If not this, then what? That is what we do through our one-on-one VIP program or our self-paced Better Belly Blueprint course and group coaching. To learn more or apply and join, you can go to betterbellytherapies.com/blueprint. I would love, love, love to work with you guys. So that is it for today. I hope that cleared up everything and so much and gave you guys lots of resources. And I will see you guys next week.
Hey friend, I hope you loved this episode. If you've been a fan for a while or newly loving this podcast, can you do me a favor? Drop into Apple Podcasts and leave me a review. When you leave a review, you do so much. You help me know you're listening. You can tell me what you're loving so I know what to make more of. And you help others by boosting this podcast so other people like you can find the podcast too. I mean, it's a win-win-win, right? So if you want a way to pay it forward, just go to Apple Podcasts or click the link in my show notes and leave a rating and review. And if you want some more free stuff, just head over to my free Facebook group, betterbellytherapies.com/Facebook, and you can get access to all of my free support for you, including some Facebook group exclusive stuff like my podcast episode vault, where you can search the Better Belly podcast by topic and find exactly what you need to expedite your healing. I cannot wait to see you in there. Catch you guys next week.